Hi guys, welcome back. I'm going to be showing you now a leg massage. So we have the hamstrings and the calf muscles that we're going to do, and you'll see that my client is comfortable. I've made sure that she is covered other than the area that I'm going to be working on. So what I've done is I have tucked in my draping, and again I've used a towel. I've used a sheet actually instead of a towel, and I've tucked it in to her underwear so that her leg is exposed for her massage, but also protecting her underwear nicely. You need to just make sure you lift it up enough so that you can get into the glute area comfortably without any obstructions. And again, I have my oil nearby so that it's very easy for me just to reapply. Sometimes if you leave your client, i.e. not touch them for too long, for example, if you walk off to get your oil or your lotion, they don't know where you are and they feel unsettled and unsafe. So try and make sure that you maintain contact as often as you can, for as long as you can. It just makes it more fluid and your client will prefer it. So not only have I put oil on her leg, I've also put some oil on her foot, and that's because what I like to do is to get into the bottom of the foot while I am doing the legs, and that's because it relaxes the person a little bit more. Foot massage is always nice to go with the leg massage, but do ask, your client may not want it or like it, so you do want to be sure that they want it before you start prodding their feet. And I'm starting with some strokes on the hamstrings, moving upwards. Remember, with the limbs, i.e. the arms and the legs, you always want to move up the limbs towards the heart, and that's because of the blood flow. We don't want to go in the opposite direction to the blood. It just interferes a little bit with the veins and the vessels and things like that. So you just want to go in the same direction, and I'm starting relatively soft. I'm also using the back of my hand like this to get in a little bit deeper now as I move up. Moving on to the iliotibial band, which can be sensitive, so it's better to start slowly and not too deep at the beginning. And then of course we have the adductors on the inside of the leg. And so I'm actually doing that now with my thumb. I'm standing close to the bed so that I'm comfortable, and I'm leaning on my leading leg and getting stuck in there nicely. Making sure that I'm working all these muscles in this area. And then I'm going to move down to the calf. Again, I'm moving up. Remember to do the hamstring area first before you do the calf, and that's because we want the blood flowing from the top section up and then from the bottom section through the top section and up. It's just better for circulation, so that's why we do that. So I'm working her calf muscle first with my palms, not too deep, and then again with the back of my hand, my knuckles. That'll be a little bit deeper. You can also use your thumbs. Remember, the smaller the area that you're using to massage, the deeper it's going to go. So when I use my thumbs, I'm going to get a lot deeper than when I use my palm. So you need to bear that in mind. You don't want your client jumping up in agony. So we want to keep it pleasant but effective. We never ever massage behind the knee into the popliteus. That's this area here. We leave it. So you can go into the top of the calf area here. We've got the gastrocnemius here and the soleus underneath. That's deeper in the center of the calf area. And we just keep it nice and slow. So the deeper you go, the slower generally it should be, and that's because it helps with pain. if you go too deep and too fast, it's quite painful. So try not to hurt when it's not, you know, necessary. So looking at the foot, I'm still massaging her leg. I have my one hand now on her foot, and I'm just massaging the tendon which runs down the middle of the foot. And I can use downward strokes now on the foot because she's lying on her tummy. So we're just going from the heel up into the ball of the foot that sits below the big toe area. And this is quite relaxing. It's also good for plantar fasciitis if you're suffering, to do the foot and the calf muscle. Very relaxing. It relaxes the muscles, the tendons and the ligaments. And of course the calf is connected to the foot, so if you want to relax the foot, you need to relax the calf too. The same as if you need to relax the lower back, it's good practice to work on the hamstrings as well. I hope you've enjoyed the video so far. I look forward to having you subscribe if you're interested, and good luck with your massage therapy. I'm sure you'll be great. Remember, the main thing is your posture. That's important. The comfort of your client. And I look forward to seeing you in my next videos.